I'm Jerry Hesch with the Hesch Institute, and this is a few questionable sacroiliac joint mobility tests. And again, that's part 3. And as stated in the previous, I work at Hesch Institute in Henderson, Nevada, very close to Las Vegas, Nevada. Website is heschinstitute.com, H-E-S like Sam, C-H. And we do consultation treatment for complex sacroiliac joint dysfunction within a whole body approach. And the preferred terminology is lumbopelvic hip complex, but again, it is done with evaluation of the whole body. We have Miss Elaine on the table, and this test can be found in the literature, and it describes testing the leg lengths with the client laying down. The presumption being that you've made a lot of effort at getting the person to lay as symmetrical as they can on the table. I won't elaborate too much. Some people do maneuvers where they lift their pelvis up and come down, and that can be done. But as I palpate her, under her medial malleoli, these ankle bones, they stick, they're big protuberances on the ankle on the medial part. She presents with relative symmetry. I can't discern a big difference there. Now, would you please sit up slowly? Okay, so if you can repeat that, go ahead and lay down, and if we can focus right into this area. I'm going to bring my thumbs this way. I hope that you're able to see that. So we're just going to look at how her lower legs respond. Go ahead and sit up again, please. I'm not sure that we caught that. So there is a little bit of asymmetry through that movement process, but let me just describe the way the test is interpreted. If in laying down, go ahead and lay down. If in laying down, the leg lengths are symmetrical, go ahead and sit up, but upon sitting, the right leg lengthens somewhat. It is interpreted in some literature as indicative that the right sacroiliac joint is stuck in a pattern named right anterior ilia. Very similar to parts 1 and 2. Again, it's a very difficult test. It's never been validated as being appropriate in isolating only the sacroiliac joint. It is influenced by hamstring musculature, by hip flexor musculature, by abdominal, thoracic, lumbar spine musculature. It's influenced by multiple joints in between. If she had restricted extension in one knee, that would alter that test. If she had a tighter psoas muscle on one side, it would alter that test. If she had asymmetry of the development of her hip joints, one side to the other, that would influence this test. It is such a general mobility test that you cannot state that it's very specific at isolating movement inside the sacroiliac joint. So clearly these 3 tests, as has been described throughout the literature as having very poor port-a-fair inter-tester reliability and no proven ability to isolate movement inside the sacroiliac joint, makes our interpretation of them very, very questionable. And this video was inspired by a client who came to see me from Canada, and she had been recommended to undergo a sacroiliac joint fusion, and she was interpreted as having instability primarily on the basis of these 3 tests. And there was some other data gathered, but basically the 3 tests were the only ones that were specific to the sacroiliac joint performed in that evaluation. And I have a copy of that evaluation, and it is of significant concern. And our goals are to function primarily as an educational organization, and we believe that before we say that a person has instability of the sacroiliac joint, much more thorough and much more very specific testing needs to occur, and as much objectivity brought to the table. I won't belabor that one. We do have a few other YouTube videos on that subject, and we have some on the role of the pubic joint, the symphysis pubis, and some on birth trauma, etc. But I'll close for now. Thank you very much.